Hello, good morning. My name is Lester. I'm going to be your nurse today. We're going to be doing two assessments, including neurological examination, as well as a hint, which is going to include your head, eyes, ears, nose, mouth, and throat. Do you have any questions before we begin? Okay, excellent. So, can I start off with your name and date of birth, please? Okay. And let me just see your wristband to verify. Okay, everything checks out. So, let's begin. Um, I'm going to start by asking you some questions just to check recent and remote memory. So let's begin. Where are you located right now? Okay. And when did you arrive? All right, excellent. So what brings you in today? Okay, just a general examination. Excellent. Okay, so now we're going to be testing for your time and orientation. Can you tell me the current president? Excellent. All right, and what year it is? Excellent. Okay. So far, so good. All right. Now, first things first, I'm going to be noticing my patient's appearance. So we're going to be focused on your posture. Make sure it's right. Your body movements are voluntary, coordinated, and smooth. Okay. Your dress appropriate with your age, gender, setting, seasons, and situation. Your grooming hygiene as well are expected to be normal. No foul odors, no drainage noted anywhere. Okay. Now we're going to move to behavior. So we're going to be looking at your level of consciousness by the questions that I just asked you. I can tell that you're alert, oriented times 4. So the year means that you're aware of person, place, time, and current event. Your facial expressions, speech, and mood are normal, non-affected, or not bizarre. Okay, so this next portion, we're going to evaluate your consciousness and your ability to retain information. I'm going to give you 4 words that I'd like for you to remember them and repeat them after we're done with the examination. So the words are going to be fun, carrot, ankle, loyalty. So just to be clear, can you repeat them for me? Okay, fun, yep, carrot, ankle, and loyalty. Excellent. Okay, so we're going to be doing a scoring test to see your neurological responses. So we're going to be doing several things. First, we're going to be doing the eyes. So we're going to make sure that your eyes open spontaneously, and they do. You're able to follow my movements. You're able to keep eye contact. So I would give you a 4, which is the highest that you could possibly earn. Next is going to be your verbal responses, and we're having a normal conversation. You're able to ask questions, you're able to interpret information, and so I will give you a 5, which is the highest that you could possibly score as well. And lastly, we're going to be looking at your motor response, and so I'd like for you to touch my finger with your finger. Okay? 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 And your motor response is a 6. And this scoring is called the Glasgow Coma Scale. The highest you can get is 15, and that's what you've achieved. So neurologically, you're intact. Everything is working good. So we're going to be doing attention span. And so I have this piece of paper here. I'd like for you to get it with your right hand. I want you to crumble it and give it back to me with your left hand. Okay. There you go. Okay. Crumble it. Okay. Excellent. So good. All directions as instructed. Judgment and thought process. Okay. Now, I'm going to be asking you some questions. If you feel uncomfortable at any moment, just tell me, and we can skip this portion, but it's very important to see the way you're thinking, your thought processes. So we'll begin if that's all right. Okay. So we'll begin with some easy questions. Where do you see yourself in the next 5 years? Okay, that's good. Well, glad to hear it. Next is, if you find a stamped envelope on the floor, what would you do with it? All right, return it. Okay, good. Have you had any nervous feelings, anxious, any thoughts of hurting yourself or hurting others? Okay, good. Glad to hear it. And have you had any thoughts or inclinations of suicide? Okay, good. Excellent. So, good judgment, good thought processes, no suicidal ideations, which is great. And now, can you please repeat me the 4 words that I gave you earlier? Okay, go ahead. Double check. And yep. Okay. Karen. Ankle. You got it. Yep. Loyalty. Excellent. Okay. I can forget them sometimes. So, it's to be expected. Okay, so that finishes our mental status. And you did it really well. Everything is good. Now we're going to be moving on to the hands, which is going to involve the head, eyes, ears, nose, and throat. This is going to be just a general overview, not too in-depth, since we do have your medical records and everything indicates that there's no known issues. So first, we're going to be inspecting your head. Okay, making sure there's no crevice, there's no abnormalities, no abrasions, lesions, masses. We're going to be looking at your head size as well. We're going to be expecting normal cephalic, which means that your head is appropriate size to your body, which it is. Next, we're going to be moving on to your eyes. Okay. So we're going to be looking for your eyebrows, your eyes, making sure that they're aligned. There's no drooping, okay, no sad, previous stroke or something, which, obviously, we would require to further look into it. So your eyebrows and your eyes, there's no drooping, no drainage, okay? Your sclera, which is the white portion of your eye, is white. And so I'm going to touch the bottom of your lids. I want you to look up for me, and I'm going to be looking at the pink conjunctiva to make sure that it's moist, pink. Okay, excellent. And now I'm going to be looking at your lacrimal glands. Make sure there's no okay, and they're dry. Perfect. Okay. So everything in the eyes checks out so far. I'm not going to be getting today into the testings for the eyes. We're going to be doing some slight testing, but it's going to be very minimal and very superficial, so nothing in depth today. So for the eyes, we are going to be doing just an exam as far as checking for your ocular motor. Okay, so I'm going to be positioning my pen, and I'm going to be moving it. I want you to follow my pen with your eyes, but don't move your head. Okay, so it's going to go okay, side to side, and downward. I'm going to be switching my hands. Okay, we're going to be coming up, side, and downward. Okay, so that's good. That is the 6 cardinal gaze, which means your ocular motor. Cranial nerves are intact. Perfect. The eyes are done. We're going to be moving to the ears. Okay, so I'm going to be feeling for your pinna, which is the outermost portion of your ear. We're going to be palpating. Okay, palpating your trays around you. Make sure there's no tenderness, no pain. Again, we're going to be looking for secretions, anything abnormal, any foreign objects stuck in there, and non-annoyed. Okay, and lastly, behind your ears, we're going to be palpating your mastoid. Make sure there's no tenderness. Okay, no bruising, and there is no noted. Excellent. So that is okay. With the ears, we're going to be doing another test called the whisper test. And so I'm going to be covering one of your ears, and I'll whisper a word, and I want you to ASMR. And we're going to be doing the other ear. Triggers. Triggers. Excellent. Okay. That's excellent. Now we're going to be moving on to your nose. The first things we're going to be looking at, see if your nose is midline, okay, which it is. It's also according to proportional to your head. The color, indicative of your background, ethnicity. So everything is good. Okay. I need to tell you to help. I'm going to be looking into your ears, both your ears. I want to make sure that they are symmetrical. Okay. There's no drainage. I also want to be looking for polyps or any foreign objects, and I don't see any. Okay. Okay. Good. There's no drainage. All right. Now next, I want you to cover one of your nostrils and breathe in. Good. And then I want you to cover the other nostril and breathe in. Okay. Good. And so your airway is patent. That means that there's good airflow in and out. Okay. Now, I do want you to close your eyes. And I want you to tell me what I have in this plastic container. Okay. Pop it open. There we go. And this is just a smell test. Make sure your olfactory nerve is working good, which is cranial nerve number 1. Okay. And tell me what you smell. Good. Okay, good. Indeed, yeah. It's ground coffee. It smells great. After we're done, we gotta have a cup. Okay. That is good. Next, we're gonna be looking at your mouth. Okay. And we're just gonna make sure that start from the exterior. So we're looking at your lips. You're gonna want to make sure that your lips are not cracking. They're moist. They're pink. Okay. Excellent. They're full. Now, I want you to open your mouth and show me your teeth. Okay, good. Now I want you to bite down. I'm going to be feeling on your masseter muscles here and temporal as well, just to make sure there's good muscle contraction. Okay, that is good. Good. So teeth are white. None are missing. If you could just open your mouth for me, wide. Good. And then can you say ah? Okay, excellent. So this, we're checking that your uvula and your soft palate in the back of your mouth rise when you say and that's indicative of good cranial nerve 9, 10, and 12 function. That off here. Okay. Excellent. Also, can you rise your tongue? Yep, excellent. Okay, we're going to be looking for moist pink. There's no abnormal drainage or bleeding. Good, which none are noted. Okay. Good. We're going to be looking at your throat. And for this, we're going to be doing a few things first. So, we want to test your range of motion of your neck, but first we just want to inspect it. So we're going to look at the neck, make sure that your trachea is midline, okay, which it is. There's no bruising, there's no abnormal colors, there's no drainage anywhere, okay, good. Now can I have you lean back 45 degrees? Okay, I want you to look to your left. Okay, we're going to be checking for jugular vein distension. Right, make sure that there's no pulsations, make sure that there's no abnormal swelling on the neck. Good. And then can you look to your right as well? Alright, we're going to be looking here. We're going to be touching as well. Okay, no jugular vein distension noted. Good. Now I'm going to be feeling for your carotid artery. So I'm going to have you touch your neck. What we're going to be doing one at a time just to make sure that there's good rhythm quality. Okay, so we're going to do ocular left. Okay, that's good. And now we're going to do your right. Okay, excellent. Okay, so now that we palpated, we're going to want to auscultate. And so we're going to be auscultating 3 points on your neck. We're going to be doing the angle of the jaw, your mid-cervical, and the base of your neck. Okay, so just stand still for me. Okay, I'm going to be listening for bruits, which is abnormal sounds. That's good. There are none present, and so we're going to check the other side as well. Okay, just take a deep breath for me. Exhale and hold. Okay. That is great. So, there is no bruits noted, which is good. Very good sign. Just try to these things off. Okay. Now, the last thing I want you to do is your range of motions for the neck. So I want you to look up to the ceiling and make sure your chin is pointing upward. Okay. Now I want you to touch your chin to your chest, side to side. Okay. And then look to your right and look to your left. Okay. Pain and tenderness. That's good. Lastly, checking for your thyroid gland and your lymph nodes. So I'm going to be checking in front of you. What I'm going to be doing is I'm going to move your throat gently to one side, and I'm going to palpate your thyroid on the other side, and vice versa. I'm going to be moving the other side and palpating with the opposite fingers. So just hold still for me here. Try not to swallow. Okay, I want to be feeling for any abnormalities, any pain, any tenderness, any inflammation that might be happening. None noted. Was that painful or uncomfortable? Good. Okay. And lastly, we're doing the lymph nodes. So there are several lymph nodes, and they're throughout your whole body. Particularly, we're going to be inspecting the one on your head. So we're going to start off with your preauricular lymph nodes, which are right here. Then we're going to be looking at the postauricular. Then we're going to be doing your occipital, which is right behind your head. Good. Then we're going to be doing your tonsillar, which are right here, and right behind your jaw. Then submandibular, right here. Submental, right beneath the chin. Superficial cervical, right along your throat. Then we're going to be doing your deep cervical, which is behind your sternocleidomastoid. Okay. And we're going to be doing your supraclavicular lymph nodes right here. All right. And so with the lymph nodes, we should not be feeling them. There should be no swelling. They should not be rigid. So we're going to begin first with the preauricular. Okay, good. Now we're going to do the postauricular. Okay, good. We're going to come down to the occipital. Good. We're going to the tonsillar next. Okay. Let me know if you feel any pain or tenderness. Okay, next we're going to work our way down the jaw. Okay, to the submental. Good. Now we're going to start doing your neck. Good. Behind. Okay, good. Any pain, any tenderness? Okay. Excellent. So that concludes our assessment. Everybody's found it. Do you have any questions for me? Good. Okay. Well, next next appointment, we're going to be further down. We're going to be doing your thorax. We're going to be doing your extremities as well, and your heart. So, I'll see you